welcome to Mental Health Matters. I'm Barbara Myers. On today's show, we're going to focus on the sexuality of people with mental illness. We have a guest here to help us understand the special challenges of mental health care in this kind of situation. Gail Jones is a licensed clinical social worker with special training in sex therapy. She also consults with other therapists on sexuality issues that their clients may be having. And I'd also like to mention that as an avocation, Gail is a stand-up comic. And she performs frequently at Bunjo's in Dublin, California. So welcome, Gail.
Thank you.
Happy to have you here. I'd like to start with a quote from Patricia Deegan, who is a consumer, a psychologist, a professor, and a speaker in the subject of mental health recovery. She says, "Those of us who have been diagnosed with major mental illness do not cease to be human beings by virtue of that diagnosis. Like all people, we experience the need for love, companionship, solitude, and intimacy. Like all people, we want to feel loved, valued, and desired by others." That is certainly true. However, take a look at these facts as reported in a study by Judith Cook, PhD. Many mentally ill people are sexually active. The studies show anywhere from 33 to 75% report being active sexually. Most do not practice safe sex. Studies show that somewhere between 66 and 75% do not use condoms, for example. They might consider intimacy and sexuality as an important part of and a human right. So people with mental illnesses consider sexuality to be important. But many repress their sexuality and worry about its normalcy and internalize societal disapproval of their sexuality. In terms of the viewpoints of mental health consumers, 51% said they lacked a satisfactory sex life. 47% say they lack a satisfying social life. 40% say they lacked warmth and intimacy in their lives. And more than 50% of board and care residents report that they lack privacy in their everyday lives. The main messages that we want to leave you with on today's show are that sexuality is an important part of the human experience and therefore of a person's well-being. People who are mentally ill should be able to have a satisfying sex life just like anyone else. And they have unique challenges in doing so, and we'll be discussing some of those. What we won't be dealing with here in depth are behavior involving sexual abuse of adults or children, sexual addictions, or gender identity concerns. So I'd like now to get into conversation with Gail and start by asking you, how did you decide to go into the field of sex therapy?
Well, basically, I'd have to sum it up as because of my own poor sex education as a child. I mean, the only thing I heard was "don't do it," you know. And I remember my girlfriend and I had heard the word condom, and we were trying to figure it out. And she told me, "Gail, I know what it is. I know what it is." And I said, "What, Sue? What is it?" And she said, "It's what a guy wears when he has his period."
Okay.
So that kind of gives you a little bit of information about my sex education, and that sort of sex education or non-sex education leads to side effects that aren't so great.
I'd like to ask you something about what a sex therapist does with a client. For example, do you stress sexual feelings and intimacy, or do you work with individuals or with couples?
Well, I've worked with individual men and individual women, and I've worked with couples in my practice. I've been in practice for a long time. And the first thing that I have to do is get a real clear picture of what the problem is. You know, like if a man says, well, I have trouble keeping an erection, I have to find out when he has trouble getting an erection. Does he have an erection in the morning? Is he on psychotropic medications that might be affecting his erection?
So some of the drugs that people take for their mental illnesses sometimes have side
Sexual
effects.
side effect. With a client like that who's having trouble with erection, they need to go to a urologist and get a total workup with the urologist and find out if there's any physical problem causing it, because you don't want to spend a lot of time doing therapy if it's a physical problem.
Right.
And also they need to have their heart checked out, you know, their vascular system, to see if their blood is flowing like it should be, because it can be indicative of some sort of problem with that. So one of the first things that I do is to suggest that they go see a physical doctor, a specialist, and one who feels comfortable talking about sex with their clients, because not all doctors do.
Right, yeah. I wonder if that's a problem with psychiatrists as well, that people may have psychiatrists that's not comfortable about discussing sex.
Yes, that can happen too, and I think that when a new patient calls, they need to ask their doctor, are you comfortable talking about sexuality, because I have some major sexual concerns that I need help with. And if they say, no, I'm really not, then you say, well, can you give me a referral to someone who is skilled at that?
Right.
Because everybody has their own upbringing and messages that they learned about sex and their own kind of education. And many times sexuality is missing in the education that people need to get. I remember many years ago, John Vasconcellos, a great senator in California, he passed a law saying that social workers and MFTs had to have at least a continuing education course in sexuality to do a private practice, and that was good. So after I have gotten some idea about what their medications are and their problems, if there's no physical problem or if there's no medication problem, and if there is a medication problem, the person needs to go to their psychiatrist and say, can you put me on some type of medication that doesn't have as severe side effects as this one does, and see if they can prescribe something that's going to help your sexual functioning as well as help your depression and anxiety or whatever it is that you're dealing with.
So getting that kind of a relationship with a doctor where you can discuss sexuality and you can talk about different medications is really important.
And you really need, as a patient, to think about, am I more comfortable with talking to a female therapist or a female physician, or am I more comfortable talking to a man? And go to the person that you're more comfortable talking about, because sometimes it's hard enough to talk about sex without having to add any gender things in there, you know. So you want it to be as easy for yourself as it can be. And then, so after all of that's out of the way, I want to get a history of their sexuality, you know, like when was their first sexual experience? What was it like? Sometimes a person's sexual experience, first one could be sexual abuse, which is very negative, or find out what kind of sex education they had. I mean, did they think a condom was what a guy wore when he had his period too, you know? And find out if they've ever had a good sexual experience and what was it that gave them that good sexual experience. What did they have in their environment? What did their partner give to them? What did they give to their partner? And people's thoughts when they're having sex, that's very important too. Because if if a person has a sexual problem and they're thinking, oh my goodness, I just know I'm not going to have orgasm. I just know I'm not going to last long enough. I just know I'm not going to get it up. Well, of course, you know, that becomes a self-fulfilling prophecy. And so as a therapist, I have to get them to think about how do you get out of your anxiety and actually get turned on. Because turned on and anxiety, it's not an aphrodisiac, let's put it that way, you know.
So is this something that's usually short-term in nature? Or?
It depends on the problem, Barbara. Like if it's a matter of education, like if a person, if say a young boy has started masturbating and doing that really fast, then when he grows up and has a partner, that's not going to work, you know, because most of the time a female needs a lot more than just intercourse in order to get aroused. Foreplay, some people call it. I don't know if it's foreplay. I just think it's doing things that's going to arouse your partner, and vice versa, because men need to be aroused too, just like women do. And sometimes men are lacking in that. They feel like they shouldn't ask for something that they want because you know, they're supposed to know everything about sex, and they're supposed to be the ones that teaches us, or at least that's what I grew up with. The men had all the answers, but as we know, they are as ignorant as we are. So one thing a person can do is educate themselves as much as they can, and if you're a parent, you need to educate your child about sex and give them a good positive sex education, not just tell them all the terrible things. Well, you can get AIDS and you can get herpes and you know all of that. I mean, just the negatives, or you can't trust people, you can't trust men, you can't trust women, you know. All those negative messages are terrible for a person's sexuality.
I'm wondering if there's anything, like a person who has had a mental illness would come to see you, whether there's anything that you would do that was anything different from that you would do for someone who didn't have a mental illness.
Well, I don't see people that don't have a mental illness.
All right.
Most of the people that I see or have seen in the past are on some type of psychotropic medication.
Okay.
But again, you have to be really cognizant of the fact that it may be something physical, and you have to have that checked out, and they really need to see a specialist in terms of psychotropic medications that can tell them if they're taking something that could be causing the problem. And I might have to go a lot slower with some people, you know, because that's always a concern, that a therapist not go too fast with the client.
What about situations where people simply can't find a medication that both allows them to have their mental health under control, but it also makes them unable to perform sexually? So if they can't find a solution medically, it seems like people would somehow deal with that and not just ignore it and pretend like it wasn't there. You know,
well, they need to find ways to pleasure themselves. I mean, you know, you can have sex with yourself too. It doesn't always have to be partner sex. And you can get massages. If you have a partner, you can have them give you body massages. Experiment. Don't let a medical person write your sex life off. There's been so much experimenting and education about how our whole body can be can feel sexual. Like I remember I went to a sex reassessment seminar one time. There were all these people sitting there in wheelchairs because they had had accidents in cars or motorcycles or jumping off the high diving board, and they were told, well, you can't have sex. You know, your sex life is over. But people in that group reported having orgasm with ear stimulation, with neck stimulation, with back stimulation. You know, there's even if you can't, whatever it is that you can't do, there's other things you can do that are going to be pleasurable.
It seems like education is really important, and I know you do consultation on education. If you were to design an education program for a mental health group, what kinds of things would you include?
Well, I would do whatever I could to have them look inside themselves and learn about themselves, because that's where anything starts, is within ourselves.
Right.
If a person was given a good sex education, they're going to be a lot more open. If a person was sexually abused or raped, they may not even want to hear the word sex.
Right.
And I had a client one time. She was a lesbian, and she went to see this therapist, and this therapist told her how awful it was that she was a lesbian, what a disappointment that she was to her parents, and that was horrible that she was told that. And so anybody that's going to work with others, they have to investigate their own stuff, their own sexuality, their own attitudes about sex, their own sex education, that sort of thing. And, you know, I kind of flashed on something else, like there's many reasons, psychological, that people don't have what they want sexually. Like if a person is terrified of intimacy, they're going to have a really hard time having good sex. If they're a very controlling person, they're going to have a really hard time having good sex. Because when you have good sex, you lose control, right? That's how people think that are very controlling. So if you're afraid of intimacy and you don't want to get very close to the person, then, you know, you have as bad a sex life as you can possibly conjure up.
Okay.
And I don't want to make it sound like that just men have sexual problems, because they don't. I mean, women have problems with arousal, with desire, with having orgasm, and problems with orgasms lead to problems with arousal, which lead to problems of desire. So I had a client who told me that she was older, she was in her 60s, that she didn't want to have sex anymore because it hurt so much, because women atrophy when they get older. Their vaginas atrophy, they dry up. They're not as lubricated as they once were. And so they have to use KY jelly or maybe some Premarin cream or something like that. Because if sex hurts, you're not going to want to do it. And sex can hurt for a woman, sex can hurt for a man. And if you start to have sex and it hurts, go to a doctor right away. Don't wait. Because if you have a sexual problem, don't wait. Go see somebody, because it's only going to stay like it is and get worse, because it's going to be harder and harder to deal with, because the time stretches out. Well, we haven't talked about it for a year. We haven't had sex for a year. We haven't had sex for 2 years. We haven't had sex for 10 years, you know. So the longer you let it go on, the more entrenched it is. Just like with depression or anxiety. The longer you don't get that treated, the worse it gets.
I'd like to talk about why the problems happen specifically with people with mental illnesses. I'm talking about Patricia Deegan's work again. She believes that the problems in sexuality with people with mental illnesses happen because historically sexuality has been pathologized, and even currently sometimes. Also, a client's history of sexual abuse and trauma, which you said that can leave untreated PTSD, and that can be very difficult. A lack of training of the staff of the hospital or the family involved, you know, can
Or the
be
therapist.
or the therapist. And then also lack of comprehensive policies in institutions and homes where people live, boarding care homes for people. The policies would address such things as prevention of rape and coercive sex, sex education, contraception, pregnancy of a client, patient's rights, voluntary sexual activity, privacy, also HIV and AIDS, you know, what's involved with that. And then also considerations for gay, lesbian, and transgender clients. You know, how do you treat those kinds of situations? So I think that's a model for, you know, what an institution or what an organization might want to consider if they were looking at addressing the sexual needs of people that have mental illness.
Well, you said something about a boarding care home. A boarding care home, nursing homes, rehabilitation centers, those places. If you have to share a room with anybody, there's no place to have privacy if you want to have sex with yourself or with a partner. And if you're in a rehabilitation center or a nursing home, they may have a lot of staff from another culture that has totally different ideas and that aren't psychologically up to date on education information at all. And I think that these places need somebody like me to come in and train their staff, because they can really give incorrect information and shame people for their sexual behavior and feel that it's not normal, that they're pervs or something, you know. And institutions need to make some place where people can have privacy to take care of their sexual needs. After all, you know, having orgasm, having good sex can release those endorphins that lifts depression and relieves the mood, you know. And it's healthy to have good sex.
Good. Well, that's a good note to end on here. What kind of people do sex therapy? I know you're a licensed clinical social worker. And are there other psychologists or other that
Yes, psychologists do, marriage, family, child therapists do. It's a matter of have they had training. And I know that, like I mentioned, the continuing education, the National Association of Social Workers, they offer quite frequently courses on human sexuality. And then if the therapist doesn't want to deal with sexuality, they have every right to make that decision that they're not going to do it, and they need to tell their patient when they first come in, I don't deal with sexual issues, but I can refer you to someone who does. And so that's why it's important. If the therapist does want to deal with sexuality and get stuck, you know, with the client doesn't really know what to do next, that's when they can call me and come in and consult with me. Or others like me.
I'd like to end this discussion with another quote by Patricia Deegan. The greatest and most healing service that can be offered to people with psychiatric disabilities is to treat them with respect and honor them as human beings. This means honoring us in our full humanity, including our sexuality and our desire to be loved. What I'd like to do now is to talk to you who are in the audience watching and ask you to think if anything that we've discussed on this show rings true to you, either for yourself or for somebody that you know, and whether any of them could benefit from the message that and the information that Gail has said. This may lead to a richer fuller life. So that's your homework. Think about how you might apply what we've done here. I'd like to give you some resources first. I'll give you Gail's address and phone number. She's in Milpitas, California, and her number is 408-946-5757. There's an organization that's called the American Association of Sexuality Educators, Counselors, and Therapists, AASECT. It's a nonprofit. In addition to sexuality educators, sexuality counselors, sex therapists, and others who share an interest in promoting an understanding of human sexuality and healthy sexual behavior. Then there's an organization called the Society for Sex Therapy and Research, www.sstarnet.org. And this is professionals who have clinical research interests in human sexual concerns. And the goals are to facilitate communications among clinicians who treat problems of sexual function, sexual identity, and reproductive life, and to provide a forum for exchange of ideas between those interested in research in human sexuality and those with primary activities or patient care. Gail, you mentioned a place that people could get referrals. Was that one of these organizations, or was that someone else?
They can contact ASEC.
ASEC would be, they would have to have referrals there.
Mm-hmm.
In addition, I'd like to mention a couple of books. One is a book that Gail wrote. It's called Let's Talk About Sex and Loving. And that was some years ago you did it, but I'm sure it's still a very good book. And then the other is, those of you who read up and research a lot more, there's a book called Sexuality and Serious Mental Illness. It's edited by Peter Buckley and has lots of studies and papers by people who are prominent in the field and research they've done and so forth. To end the show, I'd like to thank Gail for being a guest here.
I had a great time.
Okay, thank you. And the closing words are from the Reverend Wayne Arneson. Take courage, friends. The way is often hard. The path is never clear, and the stakes are very high. Take courage, for deep down there is another truth. You are not alone. Thank you for watching, and we'll see you next time.